Hello, and welcome to this Blackford Meet the Partner webinar. My name is Conrad and I'm the Chief Product Officer here at Blackford. And today we're going to talk about MaxQ AI's innovative ACCIPIO IX tool for detection of intracranial hemorrhage. To lead that conversation, we're delighted to be joined by Dr. Ajay Choudhri, who's Chair of Radiology at Capital Health Systems, and Steve Kohlmyer, VP of Research and Collaboration at MaxQ AI. Before I hand over to Steve and Dr. Choudhri, just a brief introduction to Blackford. So Blackford's mission is to make access to the most effective AI and post-processing tools easy. And we analyze hundreds of AI tools out there and select and curate them down to some of the most effective options we can see in each category. And then through our Blackford AI platform, we make all these tools available through a single contract and a single IT integration, bringing them right into your existing imaging workflow and ultimately helping to deliver or even magnify the benefits of these tools in your facility. ACCIPIO IX is, of course, one of these tools in the Blackford platform. So we're very pleased to welcome Steve and Dr. Choudhri to tell us more about it. And with that, I think, let me hand over to Steve to introduce us to the product.
Thanks, Conrad. MaxQ AI is a healthcare technology company developing innovative medical diagnostics. Our goal is to have a meaningful impact on acute care space with a focus of a broad range of proven clinical technology. Our initial applications aspire to change the diagnostic paradigm by partnering with physicians to tackle common and costly problems. Our initial application is an ecosystem of products focused on intracranial hemorrhage called ACCIPIO. It means to learn in Latin. The ACCIPIO IX solution uses artificial intelligence for a comprehensive, seamless, and secure assessment of non-contrast head CT for the identification and prioritization of intracranial hemorrhage. One thing that's unique about MaxQ is that we go to market through channel partners, such as with Blackford, and that not only increases our access to the market in general, but it also enhances our ability to integrate into the workflow by partnering with the skills and unique infrastructure that the partners may bring to bear. It also, on the backside, once you have a clinical deployment, it gives us an extended reach in terms of our clinical and technical support after the sale and into the clinical deployment paradigm. We, of course, are still there supporting the product, but as AI adoption explodes across radiology, supporting the applications in the field really will rely on the network. With that, I'm delighted to have Dr. Choudhri from Capital Health in New Jersey joining us today. Dr. Choudhri is one of our key clinical luminary sites. He's been one of our first adopters and has had ACCIPIO running for about a year and a half in his practice. And I'll turn it over to Dr. Choudhri and let him give a background on their practice in general. And then maybe start off with Dr. Choudhri, how ACCIPIO has improved your clinical service.
Good morning. Thank you for having me. So I am the chairman of radiology at Capital Health, which is a hospital system in central New Jersey. We are about 450 beds system with top-level trauma, neuro, and cancer programs. We have a busy community hospital and a busy acute care urban hospital that has a lot of time demands on our radiology practice. So we have about 16 and a half radiologists who work basically around the clock for our practice. I've been with Capital Health for about 20 years, and we've seen our radiology usage, like everybody, exponentially grow over the last decade or so. Which creates a lot of challenges for us. Primarily, one of our most important programs, what I call our top tier program, is our neuroscience program. We're a comprehensive stroke center. We have two busy emergency rooms that see about 250,000 visits, and we also have a stroke ambulance in the field, and we have a very busy helipad for fly-in strokes and fly-in traumas. So this creates a sometimes information overload for the radiology department, depending on surge levels and unpredictable events. So on top of all that, we have busy outpatient volume and busy outpatient centers that are generating CT scans around the clock. So it's a challenging environment, and I think it's very similar to a lot of radiology groups that have busy top-tier hospitals. So ACCIPIO has helped us deliver measurable results by prioritizing studies that need to be looked at a little sooner than later that may not necessarily be of the highest priority. It has basically prioritized studies that may have a hemorrhage where we weren't expecting it. And those studies have moved to the top of the list because of its prioritization abilities, and basically delivered the acute patient to the right radiologist at the right time, thereby shortening time to intervention, whether it be a neurosurgical intervention or an intensive care intervention.
What would you say is the way that ACCIPIO and AI in general has impacted your day-to-day work?
So the good thing is it has not impacted it negatively. It's not intrusive. It doesn't actually change our workflow. What it does do is get the right patient to the right doctor at the right time. So since we have dedicated neuroradiologists in our situation, they may be reading MRIs of the spine, they may be reading CTs of the cervical spine or CT scans of the head and neck. So the impact of it is if there is acute blood on a scan that needs to be looked at sooner than later, that's where it rises, or that's where it shows its true value, is it brings that study to a more acute priority, so we read it faster.
And who would you say benefits the most from the implementation of ACCIPIO?
So I think there's multiple customers that will benefit from it. Number one, obviously, is the patient, because the patient will receive a more timely read. And if there's a required intervention, then that intervention will be a little faster, whether it's neurosurgical or endovascular, number one. Number two, the radiology department is improved by tracking down sentinel events, so things that languish will not languish anymore. So there's no missed opportunities for treating someone a little faster. And then the last customer really is the hospital. So I think this product works very, very well in a busy hospital environment. There's multiple stakeholders that are involved in turnaround time and quality improvement. So I think it works well for the institution.
Okay. I'm going to talk a little bit maybe about logistics, or maybe better titled Objections. As the adoption of AI kind of rolls out into radiology, there's different viewpoints around the value of that and the potential pitfalls. So can you speak to, does AI or ACCIPIO add extra work? That's a concern that maybe some folks have.
Yeah, so I think, Blackford and obviously MaxQ are now very, very familiar with radiologists. We are sensitive to the number of clicks. We're sensitive to the amount of screen real estate we have to traverse. We're sensitive to efficiency. Anything that will impede us tends to move to the side and not be used. So in order for something to be adopted by radiologists who are already efficiency minded and basically day in and day out spend their time at a PACS workstation, even little additions of inefficiency add up over time. So with the ACCIPIO iX, it actually adds zero work, zero clicks, and is completely unintrusive. The reason I like iX, ACCIPIO, I'm sorry, is it works on a VM and it generates a result very quickly using standard CPU processor technology. And in most cases, I would say 99.9% of the time, it has generated a result for that study before the radiologist has even opened that study. To us, it's seamless. It just integrates into the workflow and doesn't really create any speed bumps whatsoever for the radiologist.
When some of the other questions that have kind of come up from the community are around security, data integrity, and just overall HIPAA security issues, what are your thoughts around that?
So I'm pretty sensitive to this topic because to do anything in our hospital, the IT department is very, very vigilant about data safety and data security. So the beauty of MaxQ helping us work within the environment is that we keep everything behind what we call the DMZ, behind our firewall and the outside. So MaxQ gives us the flexibility of either using their cloud platform where the data would leave our institution, get processed and come back, or an on-site appliance or virtual machine. We opted for the virtual machine / appliance option because the data never leaves. So I don't have to worry about data being collected on our patients, on our clients, or the institution. The data is safe because it's behind our firewall and never leaves the department or the data center. And for us, that's a very preferred solution. Obviously, if you have flexibility, you can use the cloud solution, but in our case, we prefer the on-site, basically invisible virtual machine. It sits there and does its job and just reports the results back to our PACS.
Mm-hmm. You mentioned kind of the value and importance of the ZeroClick workflow integration, not adding additional work to your time. Maybe could you speak to how the alerts come in? There's pagers, there's phone apps, there's all sorts of different paradigms, including the work list prioritization. As a radiologist, how do you kind of integrate all those, and how would you value, in particular, the prioritization within the work list?
Yeah, so it's interesting. We have quite a few radiologists of differing ages who prefer communication in different mediums. The work list tends to be a unifying medium. Everybody's very, very familiar with the work list, but I have older radiologists who want to be called if there's an acute study that needs to be looked at. I have younger radiologists who would prefer to be text, and I have some radiologists who say, don't contact me, I'll watch the work list. So it's a very heterogeneous environment, which I think you'll find across the country and across radiology departments.
Okay, great. Over the last couple of years, there's just been a literal explosion of AI technology in radiology. I think that's, RSNA last year was probably one of the starkest examples, as they opened an entire new floor for AI vendors, exhibit space, which moved to the mezzanine level. So clearly there's a lot of opportunity space in the market. What is it that you most look for with a vendor in terms of how you select your, an appropriate vendor for your solutions, your AI solutions? What are the key things you're looking for in a platform?
So I think you'll find in general, almost 100% across the board, at least in my experience, the radiologists have been pretty skeptical about the whole thing. And a lot of times it comes down to usability, integration into our workflow, and value. Obviously, there's cost involved in some of these applications. And what value does it bring to the whole work proposition? Does it increase work? Does it make our work more fluid? Does it provide more value that's demanded by other specialties? Does it attack tasks that tend to be very onerous and drudgerous and take care of what I call, the hamster wheel type things, like measuring volumes of hemorrhage and things that tend to be difficult and time consuming, but sometimes we have to do them. So I think the algorithms that will be successful will be comprehensive. So I'm not going to buy 7 different algorithms to process a CT brain. I think the algorithms that bring a suite of features that include a lot of needed features will win over the single feature products. Number 2 is speed. If I'm opening a study, the AI results should already be generated before I open that study. And number 3 is ease of use. So we all know that those are the milestones that I think any AI product, if it wants to succeed, have to get to.
You kind of touched on it a little bit with the multiple applications, but with the Blackford marketplace, there's an opportunity to get technology from multiple AI vendors across a whole paradigm of clinical utility. Can you speak to how, as you look at platforms in particular, and their access to other applications, how that kind of fits into building your own ecosystem, if you will, with AI?
Yeah, so I think it's important, number 1, to have choice, and number 2, everybody's situation is different. So if you are a 150-bed small rural hospital in Western Montana, you may not need advanced products at, say, a tertiary hospital in Houston, or MD Anderson may actually have very different needs from Capital Health. So it's important to have choice in product. So a cancer hospital, for instance, would have certain requirements that a trauma hospital would not. So I don't think you're going to find everybody's algorithm fits everywhere. So having choice and having a whole suite of products to choose from to fit your situation, I think is definitely the way to go. The question will come, whose products are best? How do you measure? Who's the clearinghouse for quality? And also, just because something's FDA approved doesn't mean that it's clinically better or the same as a competing product. Those are all things that I think will bear out in the market, depending on what happens basically in the next few years. Okay.
As you think about how you made your decision on your AI selections, for example, with ACCIPIO, what was the driving factor that really made you choose that solution?
So ACCIPIO iX is a focused product, but part of the decision making in implementing it is the products behind it. So ACCIPIO iX is basically a preview of the real technology of ACCIPIO, which is what I look forward to personally as a clinical radiologist, is actually their annotation and diagnostic products, which obviously are awaiting FDA approval. That's the generation of products I think everybody is really waiting for. And obviously that takes a lot of trial work and approval process to get through the FDA. What led me to stick with the ACCIPIO was basically the background technology. So ACCIPIO's detection and classification technology is at work when it comes to IX, but it's only a triage product. So it only indicates suspicion of hemorrhage and changes priority, which is what is allowed right now. But their future generation product using the same platform give us advanced diagnostic utility, which is detecting subtle hemorrhage, not only detecting it, but indicating where it is and showing it to you. So now I benefit from having 7 neuroradiologists on staff, which is bigger than some academic departments. But not everybody has that capability. And I think that's where a lot of these products will shine, is at hospitals and practices that don't have availability of CIQ'd neuroradiologists around the clock like we do. So the appeal of the product not only is based on the advanced technology behind it, but also its application to the entire general range of radiologists.
Dr. Choudhri, thanks so much for your time today. We really appreciate it, you sharing your experience with AI and radiology.
My pleasure.
Thank you, Steve. And thanks very much to Dr. Choudhri as well for taking the time to talk us through that. And for the insight into how AI and ACCIPIO IX in particular can make a difference in real practice. If you want to learn more about how you can integrate tools like ACCIPIO IX into your workflow, please visit the Blackford website and look out for future Meet the Partner webinars from Blackford. Thank you and see you next time.